So here we are today in class in the public health program here at the University of Canberra, and we've got two of our students giving their final presentation in the public health systems and policy course. They've been working in small teams and they will give a 20-minute presentation this afternoon, and that'll be followed by discussion among the wider group. This is a great opportunity for our students to do some group work and to develop their presentation skills.
What can change in a day? A street can become a river, a mountain can become a mudslide, a forest can become kindling. Across the globe, cataclysmic weather events are occurring with such regularity that it's being called a new normal. But there's nothing normal about it, and there's something else that lies destroyed amid the rubble: the truth about climate change. Big oil and big coal are spending big money to spread doubt about climate change. They've been able to do so quietly, but not anymore.
So that's a pretty good intro to climate change and public health together. So we're going to have a look at what is climate change, so we get a nice perspective and understanding before we try and explain what it does to us. So then we'll be looking at how it impacts the health of populations, and then have a bit of a delve into what the Australian government is doing about it. So we'll look at international commitments, government goals, fundings, and some policies. We'll look at the carbon tax.
The evidence is now clear. Industrial civilization has caused irreparable damage to our planet, and it is mainly caused by human activity. There are too many of us using too many resources too fast. We burn fossil fuels, oil, coal, and gas to meet our insatiable appetite for energy and power. As a result, this releases huge amounts of greenhouse gases into the atmosphere, trapping more and more of the sun's heat. This causes the planet to warm up, and if left unchecked, will have catastrophic consequences on not only the planet, but our health too. Consequences which we are already beginning to see. If we look at our diagram here of our planet, we can see it is surrounded by a blanket of gases, which keeps the surface of the Earth warm and able to sustain life. As we pollute more and more, this blanket gets thicker and thicker, trapping in more heat as we release greenhouse gases by burning fossil fuels. In just 200 years, the amount of carbon dioxide in the atmosphere, the major gas that causes climate change, has increased by 30%. If we look back at when the Industrial Revolution started, which wasn't that long ago, it puts into perspective the rate of decline we are putting our planet through and the rate at which we're accelerating climate change. A 30% increase in 200 years. This is a phenomenal but scary statistic. Our climate is changing. These changes we have seen over the 20th century include increases in global average air and ocean temperature, widespread melting of snow and ice, and rising global sea levels. The extra heat in the climate system has other impacts, such as affecting atmospheric and ocean circulation, which influences rainfall and wind patterns. All of these changes ultimately lead to effect of our health. Temperature. Australian average temperatures have increased 0.9 degrees since 1950, with a significant regional variation. The frequency of hot days and nights has increased, and the frequency of cold days and nights has declined. Concentration of greenhouse gases are now higher than at any point in the past 800,000 years, with an average near-surface global temperature rise of 0.7 degrees over the past 100 years. Each decade in Australia since the 1940s has been warmer than the last. 2001 to 2010 was the warmest decade on record in Australia and around the globe. Since 1950, most of eastern and southwestern Australia has experienced substantial rainfall declines. In contrast, northwest Australia has become wetter over this period, mostly during summer. From 1950 to 2005, extreme daily rainfall intensity and frequency has increased in northwestern and central Australia and over the western tablelands of New South Wales, but decreased in the southeast and southwest and along the central east coast. There will be an increase in severity of storms and change in wind patterns. Due to change in wind patterns and atmospheric pressure, there will also be an increase in the number of storms and the severity of cyclones and hurricanes. Global sea levels rose by about 17 centimetres during the 20th century and by around 10 centimetres from 1920 to 2000 at the Australian coastal sites monitored. Substantial warming has also occurred in the three oceans surrounding Australia, particularly off the southeast coast and in the Indian Ocean.
So it's very clear that climate change is a major environmental and social issue, and the impacts of it endanger our health. So evidence from the past suggests that even acute changes in climate can have serious impacts on the health of populations. But what we're facing isn't acute, it is long term. The effects of climate change can be separated into two groups: the effects that are direct and those that follow a more complex pathway. The ones we'll be looking at more in complex pathway. An example of direct is destruction from a cyclone. An example of complex is something like an altered infectious disease spread pattern. Currently, much of the discussion surrounding the threats of climate change focuses on the quantifiable risks. So that is risks to the economy, to physical property, and to the environment. The Gornet Climate Change Review, which was commissioned by Kevin Rudd in 2007, is probably one of the biggest studies done on the impacts of climate change for the Australian economy. And it takes a highly quantifiable angle as well. So it focuses on the Australian economy and environmental amenity. For example, the review discusses that climate change will affect urban water supply, and then this will mean higher costs because you'll have to build different infrastructure in the city rather than worry about not having any water. So while the review does mention climate change impacts on health, it doesn't focus on it. So Stu and I are taking these issues deeper because thanks to their difficulty to quantify, impacts on population health and survival are less understood. So clean water is a basic but essential health need. Climate change threatens water supply and water quality. Health problems from this can already be seen globally, with 1.8 million people dying every year from diarrheal diseases from contaminated water. Further, consider the effect of flooding and drought. These are two extremes on opposite ends of the spectrum, both which would cause outbreaks of disease. Flooding, for example, can cause destruction, environmental refugees, contaminated water, crowding, quicker spread of infections and waterborne diseases, and threats to food and water supplies. Heat waves will become more frequent, as Stu's mentioned, and this is a huge health hazard to populations. Heat would see an increase in vector-borne diseases, such as malaria, dengue fever, viruses, flus, as well as inflammatory diseases, such as asthma. In their Climate Change 2007 synthesis report, for the International Panel on Climate Change, Pachuri and Resinger mention that there are also many other systems and sectors that would be affected. They suggest global food production potential would increase with a small temperature rise, but then anything further than that, it will decrease, and that's not even taking into account damage to crops from flooding and storms and heat waves. They suggest people living in coastal areas will experience increased flooding, many millions more than today by 2080. They state the health status of millions of people will be affected due to climate change. For example, these are the examples they give: malnutrition, death and disease from extreme weather events, increased burden of diarrheal diseases, and an increase in frequency of cardiorespiratory diseases. And think of it this way: the world already struggles to care for those with diseases now. So imagine how it would deal if its medical facilities were underwater. That's an extreme example, I know, but 13 out of 20 of the largest cities on Earth are at sea level on coasts. And with predicted rises in sea level due to temperature changes, in the future, if we didn't do anything, we may have to consider these facilities, and emergency services, hospitals, would be unavailable to us. So the easiest way to demonstrate the deep and damaging effects of climate change is to use one example. So one of the things Stu mentioned, just one, is temperature. We're having an increase in temperature globally. So from that, we have an effect. We get heat waves, drying and drought, an increase in vector organisms and bacteria, so that's quicker multiplication of mosquitoes, fleas, all those kind of things, and a melting of ice caps. Doesn't seem like such a massive problem, but have a look at what could happen. So if we start at the top, we've got an increase in inflammatory diseases from heat waves, threats to water supplies, same with drying and drought. There's impaired food yields, which can lead to hunger, starvation, poor nutrition, which influences child and infant mortality, and also will affect the work capacity of the populations. Think about bacteria and organisms that will increase the spread of infections, and from that you've got, again, more problems going back up the top: child and infant mortality, decreased work capacity. Having a look at melting of ice caps, Consider an increase in sea level. You'll have loss of homes, medical facilities, resources, millions of environmental refugees, all living in poor, crowded conditions, leading to epidemic outbreaks, and you'll get conflict over this limited resources and facilities, and death, injury. Bit dire, isn't it?
The determinants of health seen on the slide above are all affected by climate change in a direct or indirect way. Just think about the amount of problems we would have downstream if all these determinants are negatively affected. It would mean a serious threat to the health status of all populations.
Okay, so having a look at what Australia is doing, climate change does affect the whole world, as we've mentioned, so it requires a global solution and the efforts of all. So globally, greenhouse gas emissions kind of have a stigma attached to them. They're viewed as bad, basically. So the global response is an increase in mitigation effort, and that is to reduce the severity or the seriousness of climate change. Therefore, Australian efforts in battling climate change are not exclusive, but are interdependent for success. So there are international agreements that mould and influence the goals and the actions of the Australian government. So we've got two examples up here, the UNFCCC, which is the United Nations Framework Convention on Climate Change, and that was the foundation for international collaborative effort for mitigation and adaptation to climate change. It was established in 1992 with 192 parties, which includes Australia, agreeing to it, and basically it outlines a global goal to try and stabilise greenhouse gas emissions, and it gives guidance for individual parties, requires them to report and commit to formulate, implement and regularly update national and regional plans for mitigation. The second one up there is the Kyoto Protocol, probably the best known international framework, adopted by these UNFCCC parties. In a similar way, it commits developed and transitional economies to try and limit or to reduce their emissions, and it has individually specified levels over a period of time, aiming for collective emissions to be reduced by 5% from 1990 levels to 2012, so that's this year. So Australian action, because of these influences of these international agreements, Australia is taking what we can see as a preventative approach, which we in public health love, trying to reduce carbon emissions for a clean future rather than trying to deal with the impacts that climate change will have. So the government has a comprehensive plan to move forward into what they call a clean energy future. This plan includes introducing a carbon price, promoting innovation and investment in cleaner energy and renewable energy, encouraging energy efficiency, and creating opportunities in the land sector to cut down pollution. So a couple of their aims: to cut pollution by 5%, or a net predicted 23% by 2020 compared to 2000. This is basically the equivalent of saying we need to remove 45 million cars from the road. So it's big goals. And then they aim to increase electricity generated from renewable sources to 40%, close down 2,000 megawatts of high-polluting coal-fired generation, and reduce and store carbon pollution. So if you have a look at the second point under Australian action, it's got programs. So the programs, there are many, many, many programs working towards this goal. Here's just a few to give you an idea. So we put up a list so you can understand how far-reaching and expensive this policy is. For those whose funding we could find, we've put the number up next to the program. So have a look at the Clean Technology Program, $1.2 billion. Underneath it, $8.6 billion. The Australian government also runs many campaigns based at teaching the public about the seriousness of climate change, and advertising campaigns to make sure they understand how the policies that are being introduced will affect their families and their businesses as a whole. They run campaigns that try and mould the actions of populations, so without necessarily making things compulsory. So for example, when we're in times of drought, we're encouraged to take a 2-minute shower, but we're not going to be thrown in jail for the night for having a 3-minute one. So we'll give you two examples of recent action by the government, one an incentive-based and one a disincentive-based. So the first disincentive, by far the most controversial and biggest move by the Labor government on this issue, has been the introduction of carbon pricing.
If we consider the fact that global warming was caused by us, then we can also face the fact that we can stop it. We've identified already that climate change in public health is a problem on a global scale and a problem that needs to be addressed. As of July 2012, the Gillard government is introducing the carbon tax. Essentially, polluters will pay per tonne of carbon they release into the atmosphere. Currently, polluting is free and there is no reward for a business that finds a lower polluting way of doing things, nor is there a disincentive for a business which increases its levels of carbon output. A carbon price changes this by putting a price tag on pollution. Instead of being able to pollute for free, these big polluters must pay a price for every tonne of carbon pollution they release into the atmosphere. This cost will initially be set at $23 per tonne of carbon and increase gradually until 2015. This is widely thought of as the most effective and least costly mechanism to reduce carbon output and reduce the level of climate change that is occurring. After all, Australia produces about 500 million tonnes of carbon pollution each year, making us one of the top 20 polluting countries in the world. Generating pollution does have a cost. It's a cost on our natural environment, our economy, and our way of life. And we'll quickly show you a video on the carbon tax.
Australia produces about 500 million tonnes of carbon pollution each year, making it one of the top polluters in the world. Currently, polluting is free.
Generating pollution has a cost. It's a cost on our natural environment, our economy, and our way of life. A carbon price changes this. Instead of being able to pollute for free, big polluters must pay a price for every tonne of carbon pollution they create.
Industry must factor in the cost of carbon pollution in their business, just as they factor in materials and labour. This will have two impacts. One, it will drive businesses to find new ways to reduce pollution. Two, it will make goods and services which are produced with lots of energy more expensive.
Households will notice this change through rising costs in some goods and services, but the overall impact on prices will be small. 9 in 10 households will receive a combination of tax cuts and increased payments to help them with the cost of living.
You can be part of building a clean energy future. To find out how much assistance you may be eligible for, or ways in which you can use energy more efficiently, log on to the website www.cleanenergyfuture.gov.au.
So the other example we had was of incentive-based policy, and one of the easiest ways to move people into action is to offer incentives, especially when it requires them to spend out of their pocket. So many of the climate change goals require the switch to renewable energy, which is costly. So as a result, the government may subsidise costs, provide rebates or tax cuts to assist people in making the switch. The examples we've used is solar hot water rebates. The first one, the Renewable Energy Bonus Scheme, is a federal rebate, and it's basically targeting the removal of existing electric storage hot water systems, and those who are eligible will receive rebates of either $1,000 or $600 for installing solar hot water. The second one is Victorian specific, because it's important to mention that, of course, the states and territories are actively involved in reducing greenhouse gas emissions as well. It's not just the federal government. So this Victorian one is an incentive of between $300 to $1,600 for Victorians updating their hot water systems to solar.
Climate change is real and is a massive threat to the security of our health in the future. Our pivotal generation can bring change and prevent climate change before the damage becomes irreparable. Our government is taking the steps to initiate change and bring in eco-friendly policies, but it takes more than that. We need everyone involved. As Al Gore said, this isn't your problem, it's our problem. Thank you.
Any questions? That's just a little fun bit, it's not actually. Does anyone have any questions?
I've got one question about
Yeah.
the Australian effort to address climate change through our own walk-around tax. Did you come across discussion of the idea that because we are such a small contributor to the global problem, that we're overdoing it and we have things out of proportion, and actually the impact of what we're doing here will be really minimal?
Well, one of the things I found was because Australia has a smaller population, it's a lot easier for us to bring in changes. Whereas you look at countries like the US where they have millions and millions of people, it's harder to get these laws through. So we have the advantage of having a small population, one, and two, we also have the land. You know, we can chuck, you know, wind turbines everywhere if we wanted to.
We've got the,
yeah. So Australia can lead the way in this kind of stuff. It's not at the moment, but it can. And so hopefully over the next kind of decade, we see Australia step forward in this, and we're, you know, maybe one of the first countries that is getting closer to being 100% friendly.
renewable. And on that question as well, in some of the international agreements, they'd have kind of like a partnership, I guess. So say Australia meets twice as much of the levels they have to, and another country meets only half. They can, like, in theory, borrow our success and then pay it back later when they catch up. So it works on a more global effort as well, if we do our bit. Yeah.
Did you come across the concept of co-benefits for health from the things we might do to act on?
Oh yeah, there's a million. Just think about if we're not driving, that's just one of the most easy examples. If we're not driving, how else are we getting to work? Are we walking? Are we riding? Maybe walking to the bus stop even. And then I guess from that as well, you'll have less pollution, cleaner air. Have you got any examples?
Yeah, that's a good example.
That's enough? Okay.
My roommate Chris, the other day, he told me that a flight from Australia to the US uses the same amount of puts the same amount of pollution in the air as a car driving for a year. So not that it's that related, but planes put a lot in the atmosphere. Like they're one of the big problems too.
Very good. Any other questions?
Oh.
Thanks very much for the presentation. Did a great job.